Hi peeps. This is part 2 of how to prepare to safeguard your reproductive health as much as possible in the future. If you are a woman of childbearing age, it is essential that you begin to proactively prepare yourself for what's to come and take measures where you can to protect your reproductive health choices and your rights as much as possible before Trump is sworn into office on January 20th. And in part 1, I listed a number of things for you to consider or take action on in terms of planning for your future reproductive health needs, specifically over the next 4 to 8 years. But in addition to that, there are some other measures that are worth considering moving forward. You want to secure your personal health records as much as possible. Ensure that your medical records are up to date and they are securely stored, that you have easy access to your health information, and you want to eliminate, wherever possible, any places where the government could access your reproductive health information. We have 19 attorney generals in red states that have changed or are instigating changes to allow them to track women's personal health information. That is currently ongoing and happening. They are looking at where you're seeking reproductive health care, what kind of reproductive care you're receiving. Are you getting an abortion? Who's providing that abortion? Did you cross state lines to get that abortion? And that can easily be extended to contraception and other things such as tracking pregnancy. Are you pregnant? Who is your doctor? Where are you getting medical care? Did you have a miscarriage? All those things are quite feasible to include in the future. So as much as possible, you want to eliminate or remove what information is out there, and you don't want to be giving them any more information. So be sure that you remove and completely uninstall all health information apps, any period tracking apps. That should be done immediately. Secondly, you really want to safeguard your spaces and shore up your trusted support network, which means identify 2 or 3 trusted individuals that could help you in a reproductive health crisis. And by reproductive health crisis, I don't just mean an abortion. It could be a miscarriage. It could be a pregnancy with complications. There's a range, right? So you want to identify 2 to 3 people that might support you, whether it's financial support, whether it's direct care. Do you need someone to drive you to get the required services? And when you're thinking about these people, certainly do not include any person that has voted for Trump. You want people that really value the freedom of choice and women's rights and their freedom to choose the reproductive health care that they need. So be cautious. You should not immediately include family members and friends if you don't know where they stand in this. And with these 2 to 3 trusted sources, you should probably create some code words. In the event that you need help or support, you want some code words that are not easily recognizable, but will allow you to communicate quite quickly and safely with your trusted network. Third, you want to equip yourself legally. Know the laws and policies of your state, identify legal defense options, and how you could use them. Very important to stay informed about policy changes at a federal and a state level. Understand there is an evolving legal landscape, and that's going to help you to make informed decisions ultimately. You also want to make sure that you verify your information with multiple sources. Don't believe something just because a political figure you trust has said it. Check and double check. This is your own life that you are talking about and your freedom of choice, and both are at grave risk under a Trump presidency. Fourth, stay vocal. Maintain your voice. Lots of different ways to do this. Connect with advocacy group. Engage organizations that advocate for reproductive rights. They can provide not only resources, support, but update on policy changes. Sign up to their newsletters, follow their blogs, get involved in some of their virtual discussions or webinars. Groups like the Center for Reproductive Rights, for example, have a lot of valuable information and advocacy opportunities. Participate in community discussions. Join local forums or community groups focused on reproductive health. Sharing experiences and information will help to empower all of us and those in our community. It's important to realize that there will come a time in the very near future that your reproductive health, your freedom of choice, and unfortunately, potentially saving your own life will be in your own hands. So I want to encourage all women, whether you're in your early 20s or in your late 40s, early 50s, or older and have these younger women in your lives, don't wait to plan for the worst and be prepared. Don't waste this time and the opportunity that we have. If you do, it really is going to be at your own peril. Use this moment to your benefit. Don't be a disbeliever. Take action. Be proactive. Protect yourself. And in doing so, you are also protecting children you may already have and future children that may be on the way.